Now let's discuss neurotransmitters and circuits in schizophrenia. Dopamine is synthesized in dopaminergic nerve terminals from amino acid tyrosine after it is taken up into the neurons from the extracellular spaces and bloodstream by tyrosine pump or transporter. Tyrosine is first converted into DOPA by the rate limiting enzyme tyrosine hydroxylase, which is then converted into dopamine by enzyme DOPA decarboxylase, as shown in this flowchart. The dopamine thus generated is then taken up into synaptic vesicles by vesicular monoamine transporter, also known as VMAT2, and stored there until it is used during neurotransmission. The dopamine neurons also has a presynaptic transporter, also known as reuptake pump, called DAT, which is unique to dopamine and which terminates dopamine's synaptic action by whisking it away from the synapse. Now, a point of interest is that in prefrontal cortex, DATs are relatively sparse and dopamine is inactivated by other mechanisms. So, the excess dopamine that escapes storage in synaptic vesicles can be destroyed within the neuron by enzyme monoamine oxidase A or B that is present in the mitochondria within the presynaptic neurons, and outside the neuron by enzyme catechol-O-methyl-transferase, also known as COMT. Now, interestingly, dopamine that diffuses away from the synapse can also be transported by norepinephrine transporters, that is NETs, as a false substrate. The DAT and the vesicular transporters VMAT2 are both type of receptors, and at least 5 pharmacological subtypes of dopamine receptors exist. The most extensively investigated dopamine receptor is the dopamine 2 or D2 receptor, as it is stimulated by dopamine agonist, as in for the treatment of Parkinson's disease, and blocked by dopamine antagonists, as in antipsychotics for the treatment of schizophrenia. Now, D2 receptors can be presynaptic also, where they function as autoreceptors and acts as gatekeepers, either allowing DA release when they are not occupied by DA or inhibiting DA release when DA builds up in the synapse and occupies these gatekeeping presynaptic autoreceptors. Now, such receptors are located, as we know, either on the axon terminal or on the other end of the neuron, as in the somatodendritic area. Now, as just mentioned, these D2 autoreceptor can also be located in somatodendritic areas. When dopamine binds to these autoreceptors, it shuts off neuronal impulse flow in the dopamine neuron. Thus, in both cases, occupancy of these D2 receptors provide negative feedback input or braking action.